Let me complete today's evening by talking about hip replacement using robotics. John Charnley started doing hip replacements in Wrightington right in those 1960s. From then to now, there's been tremendous change. I really think John Charnley deserved a Nobel Prize because so many people crippled with arthritis who could not walk, fend for themselves, their lives changed completely of doing joint replacement, took away the pain, made them independent. They could, and especially more so in countries where the children don't necessarily stay with them and they are so dependent on each other, so old people. And for them, this was life transforming. And that kind of a magic treatment has withstood the test of time. But it's only got better. It only got better. So these hip replacements and knee replacements, we can proudly say they'll last for 25 to 30 years. And we can say it with great amount of confidence. But one thing what you cannot say is whether every hip you do or every knee you do will last for that long. Because there's individual variations between the surgeons, the setups, the implants, and there are so many variables. We know that 70-80% done in good centers will last. What we owe to the society, what we owe it to our patients is, can we consistently do it every time and give the same results? Complications can be minimized, results can be more consistent. Can we promise each of the patients who come in that it lasts for 25 to 30 years, and that's when we can feel more victorious. Let me take you through this. Like I said, it's among the most successful procedures of modern medicine. Hip replacement more than knee replacement. I'm sure all of you see patients who have got arthritis and we do knee replacement. They all come back to you, and when you see them, the knee replacement people still have some grouse. They really, okay, they're better than what they were, but something bothers them. We have a good 18-20% of the knee replacement patients who are not completely happy. But hip is another thing altogether. We call the hip replacement surgery, if done well, it's a forgotten joint. That's the ultimate test. If the patient has forgotten he has had hip replacement surgery, it does not even remind him. You can pretty much do everything, and you sometimes get mixed up with which hip was replaced, unless you see the scar. That is the kind of accuracy is possible today. As a joint replacement surgeon, doing a hip replacement is a great pleasure because they come back so happy and so good. Today, the hip replacement, we used to use small heads of the femur, and these were the ones John Charnley invented. And then you never allowed them to do all activities. You cannot sit on the floor, you cannot sit on the low chairs, nothing was allowed. Today the bearings have changed. The quality of the metallurgy what we use has changed. We use ceramics which have less friction, last for longer. We use larger heads because the quality is so good they don't wear out even if it is a large size. The original concept was low friction orthoplasty. Friction needs to be less, so the size of the head needed to be small. Today, because the quality of the bearings, what we call the bearing surfaces, you can use a larger head, which means it's closer to your natural hip and allows you to do pretty much everything. The only difference is if you do not place the components perfectly as it is meant to be, then you have a problem. So that's why this robotics has made it so much better. I think everybody has spoken about this, Ravi and Sarat have spoken about this. What's brilliant for me is any surgery is invasion of the body. And the ultimate aim of medical science is if you can solve something without doing nothing invasive. But unfortunately, that advancement has still not come. You're not able to practice the regenerative medicine. I would never say never, but it's somewhere there, but it's still not quite here for us to practice. What robotic and stuff like this will do is you want to do the minimum, barest minimum to get the best result. So it takes away the least amount of bone, preserves most of it, and when we talk about 25, 30 years, and today our longevity has improved, if you replace somebody's hip, usually hip replacement happens in much younger people, and when you have to revise them, if they live long enough, you need 1 or 2 revisions. When you do revision, you want to have more left to do it. So this robotic replacement allows you to take the barest minimum to get the best results. So it gives you the best of both worlds. It takes away the problem and also preserves a lot of bone, which is what makes it wonderful. And it also helps you to plan ahead of time. I can tell you, and I can tell you a secret which most people don't know, is even in the operation theatre of modern operation theatres, there are a lot of implant sizes which are missing. It's like the kitchen, suddenly the masala is missing somewhere. So in spite of big centers where we do high volumes, these company people keep all implants, they're all stocked up much better. But most people don't have that luxury. And sometimes they compromise on the size which you have to put in, and that's a big compromise. It means a lot of damage in the longer version of the game. But if you're doing robotic, you know precisely the size of implant you're going to put. And you need to have that even before you step into the operation theatre. There are many, many things of this kind which will help us go. And for me, the biggest invention is haptics. Haptics, those of you who do not know, haptics is a virtual boundary which is created by the technology. It's amazing. You put your saw there and you try as hard as you want, it will not go beyond the haptic boundary. So it will cut exactly to the point and stop. So even the worst surgeon can't do the damage. So it's not unusual to have iatrogenic damage. So many problems are created by surgery. So this prevents that from happening. For me, is a great advance. And the way you can train on it is completely amazing. The learning curve when we do this is completely governed, and it doesn't let you do a mistake. Is a great way of learning. I keep saying, if you got onto a flight and you're going to Paris, if this pilot says, I'm so and so, I'm Max, I'm going to be your pilot today. This is my first flight I'm taking. Be comfortable. So would you want him to do that? And this pilot has learned through the simulation many times before he flies. And there's so much of practice he has done before he flies. The robot lets you do exactly that. So you already practiced, you're already good with it, and it doesn't let you do the mistake. Today, planes land automatically. The pilot even doesn't have to do anything. And that is the comfort we need to give to our patients as well. More so here than anywhere else, patients need that comfort. So this is an amazing tool. If you look at it, your planning happens before you start. You take your CT scan, like Ravi said, the exposure is not great. You do that, you measure exactly what you're going to be doing. And once you've done all the work before you start the surgery, on the table you do much less work. You just listen to what planning you've already done. You just execute it. And the execution is pretty much flawless because the machine doesn't allow you to make a fault. I can tell you for a hip replacement, I mean, those orthopedic surgeons, the young ones sitting there, in hip replacement, one of the things which I always struggle is if I'm going to replace both hips, am I going to get accurate limb length? Both the legs exactly same, because you imagine you finish the surgery and one leg is longer than the other leg, they'll hate you forever. You can't use footwear in one and don't use in the other. That would be a disaster. So, but those of us who do hip replacement, we find that very difficult to reproduce, because when you're operating inside, you don't have the wherewithal to make it accurate. This robot lets you do precisely. Today, when a patient comes to me, I can tell him if one leg is short because only one side is affected. I can tell him exactly I'll give the same length as the opposite side. If I'm replacing both, I can tell him both will be the same length for sure. And that is because the accuracy of the technology. There are many technical things like offsets and the tissue balancing and all that. I won't go into all those details, but it guides you through every inch of the way to give the best possible for your patients. Not one-off patients, not your VIP patients, but for every patient you operate. That's what makes the difference. So this is typically the drama, what happens before you start. These are the arrays you fix. It sounds, okay, doing all this takes a surgeon, you're happy to have your knife and start cutting open and doing it. This really takes a little edge out of that, but the bargain is fantastic, so we can do so much better. Yeah, so I was mentioning about how it guides you both with the socket and the femoral side. Both sides it guides you so that it gives you the perfect balance. This is what excites me is, you know, in the socket, the femoral in the socket, when we put an implant, we start with a small reamer, make it bigger, make it bigger. We don't know where to stop sometimes, and then we put in the real implant. When you're doing with the robot, the measurement is done. You do not use multiple reamers. You say it measures 52, you take a 52 reamer, you do it, then you put a 52 implant, you're done. You do not have a good day and a bad day in this situation. That's the magic of using this robot. So, like I said, the reaming is one time, and the placement of the cup is one time. And there's something very, see, this is this one I did on both sides, and I could, no two hips have looked so identical to me in all my 30 years of practice. When the right and the left you do, there is some difference between the two. Here I can proudly say it's pretty much accurate. Both of them look exactly the same. And the joy is extraordinary when you're able to promise it and deliver that. What is the real benefit of use of robotic? What we spoke about. It delivers consistently the same position, same style, same place, so you can have great results. See, there is something called as bone economy. I already spoken. I won't repeat that. The least amount of bone you take off, so that it's preserved for the future. This is the last point I want to emphasize on. There's something called as a combined antiversion. You guys know what's a combined antiversion, right? So when the femoral side and the socket side together have to be in perfect harmony. Only then you can flex the hip, you can abduct the hip, you can sit on the floor, still it will not dislocate. Dislocation is one of the big complications of a replacement. So if the combined antiversion is not accurate, you'll end up dislocating the hip. And this combined antiversion to produce to the perfection every time, the only way we can do it is use of technology. With a lot of experience, you get it close, but still you can have a bad day, but not with this. I said about complication rates, and I said complication rates obviously are minimized because you're not doing anything inadvertent during the surgical procedure. Yes, of course, today there's a dramatic shift. Joint replacement, when we started, we used to keep them for 7 to 8 days before we send them home. Some places it was 10 days. And today, I can proudly tell you it's come to the point of daycare surgery. So this is very interesting, how good things happen for wrong reasons. In the United States of America, hospitals are all run by NGOs or non-profit organizations or trusts. You cannot run as a private person a hospital. So doctors run clinics. They have nice big clinics. A lot of you know it. Big clinics, but you cannot have a patient stay overnight. But if you can, they started thinking, why can't we do this in our own clinics as daycare surgery so that they can make more money? To do that, you need to have tremendous pain control, tremendous accuracy, because you cannot afford to keep them overnight practically. And for that reason, they push the boundary of science so beautifully. Preoperative preparation is phenomenal. All the parameters are checked and thoroughly prepared, from nutrition to every parameter which is going to be determining how the patient behaves post-operatively is checked. Surgery is done, pain control took leaps and bounds to make them feel better so that they could send them home. And that is slowly becoming a norm. In our country, I still don't send them home on the same day, but I would love to adopt all the beautiful things they have done in terms of pain relief. Why not give it to our people Even though socially we like to stay in the hospital for a couple of days more, but at least they are pain free and they can go home quickly. So, of course, there are plenty of studies coming out. There is bias to a large extent. Definitely, robotic is taking us forward, but how much forward, how much better, only the time will tell. Right now, obviously, the enthusiasm is huge, but we are going to have some challenges about it. It's only there to make it better. Thank you so much.